we need to maybe get the upper jaw forward a little bit.
I like a long face.
Okay.
I want it like, like attractive.
So this is before we started surgery for this patient. You can see she's got a long face, hollow middle third of the face. So the first thing is this hollowness is gone, this fullness. And the next thing is the length is a little bit made less. Thing from this is Dubai. See, there are a couple of things that you have to understand. Because you have got some hollowness there, we need to maybe get the upper jaw forward a little bit. Then there's some asymmetry. This chin is a bit too big. Profile is not so nice. So we might have to do like a bite jaw for you to get good results. So which means you have to stay with us for about a week and recovery will be about 2 to 3 weeks. Can you tell me what are all your concerns?
Actually, I already did fillers on this side because it's just like
When did you do the fillers?
in Dubai.
But when?
Few months ago.
Okay, recently.
Yeah,
Do you have any pictures before the fillers?
because no, in the picture also, it's like I slightly look different. I don't know, like you might not notice it like too much.
Okay, one more thing, just put your heavy head. And this angle, you want me to do something about the shape? It's a little bit too curved and open, or you like it that way? I think it's up to you. See, we could change if you want to. We can let it remain if you don't want to. That's all. Certain things are optional also about what you like, because you don't have to do everything to change. But if you like it, we can change the same surgery as well.
And like because is it? I don't know, but because I have a prominent chin.
Yes.
Yes. I like a long face.
Okay.
I want it like like attractive.
Okay. It's already attractive, your face. But I'll make a note of that. So you like the length is okay. And you're not so much worried about this angle. Yeah, that's what I understand. You're more worried about this part than this part.
I don't know, but I'm just like insecure about the fact that it's not symmetrical, right?
That is true. Symmetrical, I've already written, yeah. Okay. But do remember, when we're doing work on the bony skeleton, it takes 4 weeks minimum to heal. And there will be swelling first. And in 1 week, it's not going to heal. It's just going to be a time where the chance of infection, chance of bleeding and everything is going to be less. So even if you go back to Dubai, but you got to be careful that the healing, so you have to take rest. You can't go back and work in 1 week. I think you should take 3 weeks leave.
So actually, I'm on vacation. I'm supposed to come back like this coming Wednesday.
Okay.
So I requested that if they could give me like 12 more days for me to rest because I made 100 operations, and they would give me 15 more days
Okay, that's fine.
as long as I will give them a medical certificate.
We will give you all the certificates from our end. And the other thing is, you have mentioned that you have some clicking with your joint, yeah?
Yes.
You've mentioned to the... That may not improve, unfortunately. I mean, in some patients, there is improvement. In some patients, there is no improvement. It's like that. We cannot control or say clearly that they might have improvement with your clicking. And then you also said something about your bite.
Yeah.
So you've got some bite issues on one side. So we will try and correct that a little bit, whatever possible. But because, what can I say? You have got a lot of concerns on the asymmetry. That's going to be our priority than the bite. See, because sometimes what happens, we have to make a decision about the facial aesthetics or the bite. If the bite is not going to be too bad, we can let the bite remain. We only change the aesthetics. We only get the symmetry. Okay, just wait on us. I will let you know in that part tomorrow. So this is before we started surgery for this patient. You can see she's got a long face, hollow, breathed out of her face. And we've done face makeover. This is her right now. You can appreciate the fullness in the winter of the face. EV live in the lower jaw. We can show you the side view as well. You can see that improvement. The hollowing has been improved. Lip has become fuller. The smile has become more toothy. Skin has become tighter. So the first thing is this hollowness is gone. This fullness. And the next thing is the length is a little bit made less. Okay. You can see this in this view, especially that thing. See that? So this is very strong. This is swelling. It'll go down. So I have a chin that's going to be proportional to your face. Okay. Also this view you see, it was like really sticking outside. So you see it's much more proportional now. You can see that view. So all bijaws take at least 4 weeks for full healing. Right? Now it's just like 1 week, 6 days or something.
So is it okay if I will go up to work like on the 2nd of March?
Yes, you can.
Okay. So now
But you take a lot of time for the sutures inside to dissolve. The stitches will take 1 to 1.5 months to dissolve. The bones will take 1 to 1.5 months to get healed. And the total swelling might even take a few months. But after 10 days or 2 weeks after surgery, you can have normal food. You can do most of the activities except a lot of physical exercise or swimming or anything. After 2 months of surgery, you can do everything what you used to do before surgery. Everything.
so now I know like excessive production of saliva.
Yeah, this is because of 2 reasons. One, because you're finding it difficult to swallow because the muscles are all new. And also because a lot of stitches are there and, it's just irritating. It'll come down in 2 or 3 weeks. It'll take a while, yeah. You may have to keep
What I cannot brush my teeth.
You should. You can brush your teeth now.
How about flossing?
Yes, you can floss. Yes, you can do everything.
I can sleep on my side.
No, better not to sleep on the sides. If you sleep for a brief while, it's okay, but avoid sleeping on the sides. I think it's better not to sleep on the sides for 2 more weeks.
How about braces? I can also
Sorry?
do that braces.
Braces if you want. Yes, you can do after 3 months. You can do the braces after 3 months. All right?
So after I will finish all the medicine.
You don't need any more medicine. That's enough. Yeah? Thank you. Bye. I just... Or 12.